Good morning, friends. So, as we have spoken last time, today let's discuss in depth that is heel pain. So, heel pain. This is a model of the foot bones and this is the heel. So, usually you get pain more frequently in the heel part. This is more common during the winter seasons when people get up early in the morning. They are unable to put weight on the foot, saying that it's very painful. So, what are the causes of this heel pain? As the common cause of heel pain is the contraction of the plantar fascia, which is a part of the heel. So there are two parts of the treatment. One is precautions, the others are exercises. Precautions, first thing is that you have to change your footwear. So supposed to use UCBL footwear or gel foam footwear, and you can go to any prosthetic or orthopedic shops where they'll make you customized footwear, or you can buy it ready-made also. But these footwear, whether they are slippers, sandals, or even you can make insoles for your shoes. You have to wear them whenever you're walking, whether inside the house or outside the house. Coming to exercises. Whenever there is an acute heel pain, that is very severe heel pain, you should not supposed to do physiotherapy exercises in acute pain. Let the pain come down a little. Start using the footwear. Just do mild warm water fomentation. So let's talk about another common ailment, that is back pain. What are the causes of back pain? Sitting for long hours without proper support or improper posture, bending forward and lifting heavy weights, doing exercises in the wrong position, which will cause back pain and sometimes even disc problem. First part of the treatment is precautions and back care. Second part are treatment, medication and exercise. What are the precautions with which you can avoid back pain? The first and most important thing is avoid bending forward and lifting heavy weights. If you have to pick anything from the ground, bend your knees and pick up things from the ground. If you have to turn around, turn your entire body around. Don't fix the legs straight to the front and just turn your upper trunk or upper body around. That is a wrong way of doing it. If you have to sit for a long time, always maintain your posture with a straight neck and a straight back. Sitting in wrong postures is one of the most common cause of back pain. There are strengthening and stretching exercises for the back. So first thing is hip lift. What is hip lift? Lie straight on the ground. Just lift both your hips with the legs and the upper back touching the ground. Hold it for 5 seconds and drop down slowly. Second one, leg pull. You have to again lie down on the ground. Bend one knee by keeping the other knee and leg straight attached to the ground. The bent knee should be brought till the chest. Hold it for 5 seconds and then straighten the knee. And do it for 5 times. Then switch the sides. Do it with the other leg for 5 times. The third exercise, elbow press. Lie down straight again so that your buttock and upper back and head are in touch with the ground. Just lift the lower back up with the pressure on the elbow. Push yourself up the lower back. Hold it for 5 seconds and then come down slowly. Do it for 5 times. Fourth one is back press. The fifth one is back release exercise. Again, the patient should be in supine position. Just lift your lower back, tighten your front abdominal muscles and the buttock muscles. Hold it for 5 seconds and then slowly come down and repeat it for 5 times. What is back release? Back release is relaxing both your abdomen muscles and the buttock muscles so that lower back touches the ground. Do not sit on the hips immediately. Wait for 5 seconds and come back to your supine relaxing position. Coming to the strengthening exercises. This exercise has to be done again on the ground or on a firm bench. You have to lie on your stomach with the face facing down and your arms to the sides. Just lift your head without lifting your shoulders. Hold it for 10 seconds and keep it down. And do it for at least 5 to 10 times. Second exercise. Lift your head and your shoulder as high as possible. Hold it for 10 seconds and then come down. Third exercise. Lift your head and shoulder. Lift your left hand and right leg up. Hold it for 10 seconds and come down. This third exercise can be repeated with the other hand, that is the right hand and the left leg. Fourth exercise. Again, lying down on the ground. Lift your head, shoulders, the hands straight up and also the leg up so that your entire weight is borne by the abdomen and the pelvis. Hold it for 10 seconds and come back into the original. Let's talk with another common pain, that is neck pain. What are the causes of neck pain? The common causes are using a thick fluffy pillow. Second thing, sitting in improper posture. Third thing, sitting for a long time without proper support to the neck. So let's start with the treatment. The first part is precautions and neck care. Second part is medication and exercises. What are the precautions you can take? Always use a firm, moderate or thin pillow while you are sleeping. And if it is still difficult, use a contour pillow which are commercially available, or roll a towel and place it below your neck so that your neck gets proper support while sleeping. Second point, do not lift heavy weights on your head. Third thing, Do not keep your chin down and hold it for a long time or work for a long time with your chin down. So now let's coming to exercises. When there is acute pain, always visit the orthopedic surgeon, take medication for pain, let the acute pain come down, then start doing exercises. Never do exercises in an acute painful condition. So there are two types of exercises. One is strengthening exercises, the other one is stretching exercises. The first stretching exercise, sit in an upright position while you are standing. Just bend your head down slowly so that chin touches the chest. Hold it for 3 to 5 seconds. Then slowly lift your head up so that you see the roof. Hold it for 5 seconds. Repeat it 5 times and stop. Second thing, turn to the right. Hold it for 5 seconds and then turn to the left. Hold it for 5 seconds. Repeat it for 5 times and then stop. Coming to the strengthening exercises, hold your palm to one side of your head. Let it be right or left. Try to push the head with your palm. At the same time, the head should resist the force. This will strengthen both the neck muscle. Same thing, do it with the opposite side, at least 5 to 10 times. The second exercise is lock both your hands, place it on your forehead, push the head back with both the hands and try to resist that force with your head pushing forward. Hold it for 5 seconds and leave it. Do it for at least 5 to 10 times so that the back neck muscles get strengthened. Same thing, lock both the hands, keep it behind the head, try to push the head forward with the hands and the head should resist that force. This is an important note regarding the neck pain. While doing these exercises, either stretching or strengthening exercises, if you experience any excruciating or severe pain of the neck, just stop doing exercises. So coming to the fourth type of common pain is knee pain. The common causes of knee pain are in young people. Usually it is due to some old injury, that is a meniscal injury, that are like washers between both the bones within the joint. So coming to the elderly people, the common cause of knee pain is arthritis. This arthritis could be commonly because of damage of the cartilage as aging goes, or else because of old knee fractures. So let's go to the treatment part. The treatment part again has two parts, that is precautions and exercise. What are the common precautions we have to take to avoid knee pain or to reduce the existing knee pain? First thing is avoid sitting cross-legged on the ground or in the sofa. Second point, try to avoid climbing stairs and or minimize it as much as possible. Third thing, try to use a Western commode while going to the bathroom instead of an Indian style of bathroom. Avoid squatting exercises because while squatting, 5 times the body weight goes through your knee. So avoid squatting exercises. Fifth point, use proper footwear for walking and try to walk on firm grounds and avoid very hard grounds. Sixth point, avoid using high heels or sandals because if you use them, the biomechanics changes and the load on the knee increases. Coming to the strengthening and stretching exercises for the knee pain. Always do it on a firm ground. Instead of sitting on the ground, you can do it on a bench in a supine position. That is, lie down straight with the head facing the roof. The first exercise is roll a towel, keep it below the knee and press the towel with the thigh and the knee and try to pull the foot towards the face. The leg has to be straight. Hold it for 10 seconds, then leave it. Do it for at least 20 times and you can also do it on both the knee joints. Second exercise, just sit on a high chair, straighten legs hanging down, then straighten one leg and try to pull the foot towards yourself. You will feel a stretch behind the knee. So hold it for 5 seconds and then leave. You can do it on both the knees so that your hamstring muscle, that the muscle or back of the thigh gets stretched. Third exercise, just lie down straight on the bench. Keep your knee straight, don't bend the knee. Lift the leg for at least 10 to 20 degrees just to about 1 feet in the air. Hold it, count 10 and bring it back. You can do this on both the knees. The fourth exercise for knee pain. Lie down in a straight position on a bench. Bend one knee or the right knee with the heel on the ground. The other leg should be kept straight with the knee straight and lift it around 2 feet in the air. Hold it for 2 seconds and keep it down. Repeat it in the opposite side. By keeping the left knee bent, the right knee is straight and lift it up to 2 feet. Hold it for 5 to 10 seconds and keep it. So today friends, we have learned many things about back pain, neck pain, knee pain and heel pain.